COVID is real. Wear your mask, wash your hands, stay home, okay?
Hey guys, welcome back to my channel. So I'm here today with my husband Patrick, and this is the first video in a series of videos that we're going to entitle Journey Through Medicine. We really wanted to sort of take you guys through our lives as doctors and sort of give you a glimpse into what it is that we do. So I've mentioned before that I am a radiologist. I actually just finished my residency a few months ago, and I'm currently in my fellowship training. So a lot of you have heard the term radiologist, but may not know what it is that a radiologist does. So a radiologist is a licensed physician or a medical doctor that focuses specifically on the interpretation of imaging. So imaging can be anything, from x-rays to MRIs to CT exams to nuclear medicine exams. There are so many different imaging modalities. So a radiologist specializes in reading or interpreting those images for the purposes of diagnosis and sometimes treatment as well. So there are a number of different interventional things that you can do to actually treat disease as well. More specifically, I am a breast imaging radiologist, so I'm currently in my fellowship, which is a subspecialization of radiology called breast imaging. And that fellowship training will allow me to specifically focus on interpreting imaging related to the breast. So things like mammograms, things like breast ultrasounds, things like MRIs. So I will be a specialist in sort of women's imaging related to the breast. In addition to interpreting imaging, I also do things like breast biopsies. So if you maybe potentially have a suspicious finding in the breast and need a biopsy, I would be the one to do that as well. So it's a very rewarding field. As you guys know, this is October, which is Breast Cancer Awareness Month. So this is very, very relevant. But yeah, that's what I do. And I'll let Patrick go ahead and tell you what he does.
Well, before I cut into what I do, I just wanted to say that the radiologist is a physician's doctor. They use radiology for a lot of things, especially diagnosis. So what you do is very important, and I've seen it across various disciplines.
As is what you do, sir.
Okay, so what I currently do is I'm an anesthesiologist. I finished my residency a few months ago, or several months ago. I did a little bit of private practice before starting my current fellowship. My current fellowship is in regional anesthesiology and acute pain medicine. I'll talk about anesthesiology first. The anesthesiologist is the physician who takes care of you in that perioperative period. That's that period before, during, and after surgery. We're the doctors that make sure you're optimized and ready to go to surgery. We're also the doctor who makes you feel calm. We have fun with you. Make sure you're relaxed before going back into surgery. We're your advocate. When you're in the OR, you're asleep. We take good care of you. We make sure that your blood pressure, vital signs, and all that stuff remains normal. A boring day in the OR is a good day for the patients. So that's what we strive to do. We also make sure we wake you up from your surgery, make sure your pain is well controlled. We also take care of you when you're in the recovery room. So if there's any issues that happen while you're in the recovery room, we're the doctors that manage those issues. You also see us in the ICU. Traditionally, anesthesiology and critical care were together the same thing. If you think about it, the operating room is a mini ICU. So our skills translate directly into the critical care. So you'll see us there too. Then you also see us in OB, or especially patients who are pregnant, they're about to have a baby. We're the doctors who give their patients the epidural or spinal so that they can deliver their baby comfortably. Or we're the doctors that place the spinal so that you can have your cesarean section safely. All right? We are the eliminators of pain. We love keeping our patients comfortable. One of the other techniques that we use to take away pain or alleviate pain is regional anesthesia, which is what I'm specializing right now in. Specifically, we use ultrasound to help us see nerves, and we use local anesthetics like lidocaine or its cousins to give you a nerve block. That way you can have surgery, let's say on your hand or your arm, without having to receive general anesthesia. That means you don't have to have that breathing tube into your windpipe. We can just give you medication to help you fall asleep, and your arm will be numb while the surgeons do their surgery. And not only is it great for intraoperative care, when you wake up, there's still some of that local anesthetic present, such that it provides you with pain relief. Sometimes you don't even need any oral pain medications after surgery. So that's the main thing that I do. Lastly, we've played a big role in this COVID-19 epidemic. We are usually the doctors that they call to intubate patients. As a resident, I intubated several patients with COVID-19, and I saw how crazy that disease was or is. Where I did residency, we were at one of the hot spots, so I saw an ICU full of COVID patients, which then expanded to 3 ICUs full of COVID patients, and we were those doctors who were replacing the breathing tubes for those patients who needed it. COVID is real. Wear your mask, wash your hands, stay home, okay? We'll talk more about our specialties in future videos, and we'll also discuss how we got to where we are now.
Alright, so I guess we'll get into a little bit more about how we got here. How we, our journey to medicine, how we became doctors. So I'll start off by asking Patrick, did you always know that you wanted to be a doctor? Can you...
Well, to be honest, the answer is no. I actually I enjoy cars. I enjoy drawing. I'm an artist. When I was young, I did some computer engineering. That was fun until I got bored of programming. My original career was to be a mechanical engineer because I wanted to design cars. I went to school, started off taking engineering classes, but while I was in school, my grandmother came from Nigeria, and she had pulmonary fibrosis. It's a disease that affects the lungs. She also had diabetes, and unfortunately one day she went into a diabetic coma. Her blood sugar was low, and she went into a coma. We thought she was just asleep, and within a couple of weeks later she passed away. And that's when I first became interested in medicine. How about you?
So when I started college, I actually was more along the lines of thinking I might be interested in engineering, potentially biomedical engineering, but I wasn't sure. I also liked physics a lot, so I went in initially, started college as a physics major, and I was just going to sort of see, where that took me. And I think it wasn't until I started sort of doing extracurricular activities. There was a point where I volunteered in the ER, and I was like, oh, this is kind of neat. I've been sort of exposed to some aspects of medicine because my older sister was a nurse at the time, so I had that sort of, perspective of, medicine. But yeah, it was sort of getting into college and doing different extracurricular activities and finding that I liked helping people in this way. So that's sort of what got me thinking about medicine and exploring it.
Well, that's interesting because after that incident happened with my grandmother, I told my mom that I was thinking about medicine. My mom's a nurse, and she said, no, 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 you do not want to be a doctor. I do not. She told me that they don't have a life, you're not going to be happy. So I just remember that. And the interesting thing is I used to volunteer in an emergency room just like you did. And I remember, I don't know if at the time if they were ER doctors or if they were trauma surgeons, but I do remember 3 different people telling me that I would hate my life if I went into medicine. I don't know what phase of training or what part of their career they were in. I can tell you that at some point in my life I felt like it was very tough, but honestly, like now that I've finished residency and I've practiced a bit, I don't agree with the sentiment that they had. I think you have to want it, like you have to want to be in medicine. It's not about money. Your reward is not going to be the money. You're going to live comfortably, and actually for the most part, you're going to be in debt while you're doing your training, and you're going to be in school for a very, very long time. But you have to enjoy working with people. You have to care about people genuinely. And
Yeah.
I mean, that's my reward. The smile that I see on my face or my patient's face when they wake up from surgery, or them telling me thank you for taking good care of me, or I will never forget the lady I placed the epidural in for. She was sitting there, and I was sitting right next to her husband, and she told me, "You're my favorite person in the world." Like, that is my reward.
That's how people often feel about their anesthesiologists, especially if you've had a baby. You'll know you love your anesthesiologist once you get that epidural. So, yes, no, I think I totally agree with you. You definitely have to genuinely care about people to be in medicine. I think that it's difficult otherwise to be in medicine if you don't care. You need to kind of bring that to every patient interaction that you have.
Yeah.
But yeah, there's been a lot of, I think you often hear about how long, it takes to get through medical school and then residency, and it's just a very, very long, taxing process. So if it's not something that you want, I think it can be very challenging to kind of stay the course. Let's sort of talk about that journey through medicine and what it entails. So we sort of mentioned college, but Patrick, can you tell me kind of in your own words, what is kind of the journey? What does it take to become a doctor? Can you talk a little bit about the length of training and, whatnot to get to where you are now?
Oh, sure. Yeah. So traditionally, becoming a doctor requires 4 years of college. Most medical schools require you to have a bachelor's degree. So then you go to medical school, which is another 4 years. Medical school is considered undergraduate medical education. So after you complete medical school, you have the foundation and knowledge that every physician or doctor should have. So then after that, you do residency. Residency is what we call graduate medical education. And depending on what specialty you go into, it may vary from 3 years up to 7 years. Most of your generalists like internal medicine, family medicine, emergency medicine, those might be 3 years. Whereas surgical specialties such as neurosurgery, they may have 7 years of training. But even if you go into medicine, for example, which again is like a 3-year specialty, if you decide to specialize or further specialize, let's say in cardiology, you may be adding another 3 to 4 years to your training. So just to summarize, it requires 4 years of undergrad, 4 years of medical school, anywhere from 3 to 7 years of training before you're an independent physician. And before you practice independently, you have to take a board exam. You want to be board certified by your specialty so that you have met the minimum requirements to be proficient in your specialty.
That's a really good, I think, overview of things. Like Patrick said, 4 years of undergrad, 4 years of medical school, and then a number of years, anywhere from 3 to 7 years for residencies, as we call it, or graduate medical education. After that, you can also, like you said, further subspecialize in things like fellowships, which is kind of where we are in our training now. So we've done undergrad, we've done medical school, we've done residency, and now we're doing fellowship, which is additional training after residency. So it seems like it goes on forever, but it's actually great, and it's worth it if you're in a specialty or a field that you enjoy.